The purpose of this video is to provide an overview of the basic components of acute inflammation. The inflammatory system is activated by tissue injury. It is vital to note that inflammation only occurs in vascularized tissue, that is, tissue which has a blood supply to it. In addition to the common example of infection, there are other potential causes. These include causes by mechanical damage, such as laceration or damage to arterial endothelial cells, as is what happens in the first step of atherosclerosis development, or necrosis caused by factors such as ischemia, temperature extremes, lack of nutrients, etc. This system is activated quite rapidly. Within seconds, chemical and cellular components are called into action. This is considered to be what we call a nonspecific response, meaning that it takes place in a similar manner despite the type of stimulus. Unlike the acquired immune system, or third line of defense, the inflammatory system is also nonspecific due to the fact that it responds in the same way whether or not the body has previously been exposed to the same stimulus. Although inflammation is generally a helpful mechanism for the body, it can produce some uncomfortable signs and symptoms. Anyone who has ever had a scraped knee will remember the pain, redness, heat, swelling, and possible loss of function that it can accompany the healing process. There are key inflammatory processes which happen near the site of tissue injury. The first is vasodilation, or increase in the size of the blood vessels. This leads to an increased blood flow to the area of tissue injury. The second component is increased vascular permeability, in which endothelial cells of the vessels retract to form pores through which fluid leaks from the circulation to the tissues. Consequently, this is why we see some swelling near the site of injury. This enables inflammatory products, such as leukocytes and plasma proteins, to leave the circulation and travel to the site of injury, while the increased blood flow to the area often leads to redness and warmth. A third process is what we call white blood cell diapedesis. White blood cells leave the circulation through these pores, heading, of course, to the site of tissue injury with the goal of eliminating the causative agent.